Hi everybody, I'm Dr. Scott Glidden from Select Pain Care, and today I'm going to explain why I haven't adjusted a patient in almost a decade, and why I never will again. At Select Pain Care, we specialize in fixing chronic nerve, muscle, and joint problems, particularly with people that have been suffering for over 6 months and have already seen at least 3 other providers. So why do we choose these patients? Why don't we help everybody? And how the hell do we actually help these patients we do see? Well, let me take you back to the beginning. When I first started chiropractic school, I thought I had it all figured out. I want to help athletes return to their sport. I had assumed they'd be more motivated to follow a doctor's recommendations because they had a strong goal of getting back in action. Spoiler alert, super wrong about that. To figure out how to reach my goal, I asked around campus and found out about a chiropractor with his own extremity adjusting technique. He offered classes at night after school was over. And if you completed the courses, passed the test, and became his teaching assistant, there was a good chance he'd get you an internship with the pro team. So I signed up. I took the classes. I passed the test. And I spent 2 years as one of his teaching assistants. While I was doing that, I noticed another TA studying a book during one of the doc's lectures. He told me about active release technique, or ART, a soft tissue treatment that's great for treating athletes. After hearing this, I decided to dive in and attended ART seminars while I was in school. So upon graduation, I had learned to adjust about every bone in the body. I was full body ART certified and had also gotten familiar with Graston technique, a tool-based soft tissue treatment. When I graduated, I thought I was set. I thought I could fix pretty much anything that walked in my office, or so I thought. Sure, for a lot of patients, adjusting the soft tissue treatments worked, but there are always those cases where it didn't matter what the hell I did. The symptoms just kept coming back. In school, we were basically taught to blame the patient's lifestyle choices, or that's just their listing. It was never our fault. But this didn't sit right with me. I realized that while school had taught me to treat, it hadn't taught me how to evaluate a patient. I didn't know how to assess the severity of an injury, what was causing the symptoms, or when it was time to refer a patient to someone else. One day, I saw that a classmate of mine from chiro school had been voted the best chiropractor in his area. Pretty large area too. He's fairly new to practice, so I reached out to him to learn what led to his success. That phone call changed everything. He asked me, "You ever feel like you have the tools to fix a patient, but you don't know where to start?" I said, boom, that's it. And he told me about something called integrative diagnosis. It's a system that focuses on diagnosing the problem first rather than just treating symptoms. It's entirely soft tissue based, no adjusting. But as my colleague put it, people come to you for results, not for an adjustment. That totally made sense to me. So people might love a good stretch, massage, or that satisfying snap, crackle, pop from an adjustment, but if they just felt like they didn't need those things, they'd probably be pretty happy with the results. At the heart of integrative diagnosis is adhesion, which is also known as scar tissue or fibrovascular bands if you're a research person. They occur when tissues are overused or injured and don't heal properly. They limit range of motion, strength, and sometimes they entrap nerves. ID focuses on treating these adhesions with precision, targeting them based on their impact of function. You always start cases fixing the biggest and most impactful adhesion each appointment first and work your way down the priority list. In contrast, methods like ART treat the entirety of several muscles each appointment. Not only is this less focused, but the provider, me, is far more likely to get overuse injuries from these patients. I took my first ID seminar in 2015, and since then I haven't adjusted a single patient. At first, I wasn't great at it, but I knew that with a system to build on, I could be more effective than someone who was just great at adjusting and didn't have a chance in hell of figuring out what's going on. Since then, things have evolved. When Dr. Bill Brady, the founder of ID, retired, 2 doctors who have trained extensively with him, Dr. Matt Lytle and Dr. Brandon Cohen, continued to innovate and teach. I now train with them quarterly at Precision Health Group outside of St. Louis. I have bi-weekly coaching calls to discuss patient cases. I also work with another soft tissue specialist to practice palpation of anatomy and treatment protocols. After all, you can't treat what you can't understand. I do this weekly. The more I learn, the more I realize how much there is to learn. My goal is to continually improve my ability to assess, diagnose, and treat patients. The better I get at these skills, the less time it's going to take for patients to get better, and the more people I can help, because being awesome at your job is a great referral motivator. And that's why I'll never adjust another patient. With everything I've learned, about how to properly treat the tissues that support the joints and the discs. Adjusting simply isn't necessary if the tissues around them are healthy. So thanks for watching, and I hope this helps you understand our approach at Select Pain Care a little bit better.